So I know there's many new members. Welcome. We are so glad you're here. So far, this group is closing in on $28,000 by 62 members. This is a record number, and especially because we haven't heard from any of the recipient organizations yet. So it is just going to go up, and dang, I mean, we say we are so powerful together. So the more we have, the more we get to give out. So if you could please share the communications and the recordings that we send out, and send them to the people in your lives who share your passion for this very important mission and topic that we're going to be covering. So I want to just give you a brief overview of how the Giving Circle works, specifically at Aurora. There's no minimum donation to become a member. It's $25 or $2,500. Each member has the same voting power and the same voice. 100% of donations go directly to the 4 chosen community organizations. We adopted these policies in 2020 because we want this funding to be collected by anyone who believes in supporting women and girls, and for it to go to where it's needed most and makes the greatest impact. We are all stronger together, and it is shown in this group for sure. During each meeting, members learn about the critical issue and about each organization we're funding. We urge you to learn more about them. We will try to put things in the chat if it's specific data or action items that would be helpful to them, and volunteering for them. So this week and next week, we will be hearing from them at the final meeting, which will be an in-person lunch at the JCC in West Hartford. That's May 29th, and it's at noon. The members will discuss and work collaboratively to vote on fundings levels for each of the organizations. So all of the organizations receive a level, but Giving Circle members vote on how much each one received of the final total. I know that you will be impressed by the thoughtfulness of this group and fascinated to see how this process unfolds philanthropy and how hard it is to divide money up to such worthy recipients. There's never enough, but when we work together, it makes a larger impact than giving alone. Our fabulous steering committee helped identify this year's recipients as Mutual Aid of Hartford, the Diaper Bank, and today's expert speakers, Reproductive Equity Now and Planned Parenthood of Southern New England. There will be time after all of the presentations for specific questions, which you may post in the chat as we go, and the staff will keep track of them. And I am now going to turn this over to our amazing leader, Dr. Jennifer Stedman.
Well, I mean, it's a little bit gray and rainy today, but I don't know about you, but I feel like this Zoom is full of sunshine. I love to see all the fabulous longtime Aurora supporters on here, and excited to have new folks that have been connected. Going to shout out Catherine Ballard just posted in the chat that she was connected by a friend. So thank you to all of you who have reached out to your networks and helped us raise our record-breaking amount of money so far. So we're thrilled to have you today. I will not talk very long about Aurora, but I feel like since we have so many new folks, and because Aurora does so many things, that I kind of tried to break it down into chunks to share. So today I'm going to talk about our efforts around research and data. Anyone will tell you that I really nerd out about our amazing efforts to really document the needs and challenges that are facing women and girls across Connecticut. Our research is, while our giving is focused in Greater Hartford, our research really is statewide. You can visit our Women and Girls data platform that we partnered with Connecticut Data Collaborative to produce. It gets updated every year, and it has, just key data that makes it very easily accessible. If there are folks on here from nonprofit organizations, it's a great place to get information to be able to put in grant proposals. And that's really how we think about our data and research efforts. this is another way that we can support important community organizations. We can do the research that they can't afford to do themselves and help them make the case for the fabulous work that they're doing. Sorry, can you back up one more? So also on this slide is our essential equity report on women, COVID, and rebuilding Connecticut. Our research and data really punches above its weight. We were really the first organization to put out real-time data in the nation on the disproportionate impact of COVID on women of color. It's something that I remain incredibly proud of, and that was widely shared across the state with legislators that gathered and led a coalition of folks from around the state to come up with policy recommendations as well as that important data. So that's a real milestone for us. Next slide, please. We followed that up because we saw in that report the kind of that housing was going to be a critical need and continue to be. We again partnered with Connecticut Data Collaborative and the Connecticut Fair Housing Center to do a report that really looked back to 2017 at all of the evictions in the state. The state was not collecting information on gender and race of those who were evicted. So Connecticut Data Collaborative went back case by case since 2017 to determine the race and gender of those facing eviction. And we weren't surprised to find out that it was disproportionately women of color, Black women and Latina women who were impacted. They used this data in the legislature, which we were super proud of, and it helped to push them to do the make sure that tenants would now have access to free legal representation that previously only landlords had. So it was a huge impact. Next, please. We just this past fall released a follow-up to the COVID report that was really looking at the continuing economic effects of COVID on women across the state. And if you go to the next slide, we were super proud that that research was featured on an episode of the Disrupted podcast with Kalila Brown Dean. And so, you know, that's an NPR CP public broadcast. So really, we were getting statewide and nationwide attention for that research that was so important. And we're super excited that Kalila Brown Dean is going to be the keynote for our Luminary event in the fall. So if you want to hear more from her, she is amazing. And then just this January, we published research in partnership with the Institute for Women's Policy Research around student moms and what they need and how that might inform Aurora's grant making for college success that I talked to you about last time. So we are incredibly proud of these research tools, and we really work to make them accessible and available for organizations serving women and girls across the state. So that is just another aspect of what Aurora does. And now I am super excited to introduce Liz Gustafson. She's the Connecticut State Director of Reproductive Equity Now, a co-founding board member of the Reach Fund of Connecticut, which is a fund that raises money for access to abortion. She is a former clinic escort volunteer and a native nutmegger. Prior to joining Reproductive Equity Now in the summer of 2023, Liz served as the State Director of Pro-Choice Connecticut, which sunset its operations this past fall. Together with elected champions and coalition partners, Liz continues to lead bold policy efforts and has secured several legislative victories in Connecticut, including data privacy protections for those seeking and providing abortion care, and the Reproductive Freedom Defense Act, the first safe harbor law in the country. Liz has been recognized for her commitment to protecting and expanding reproductive freedom by none other than Cosmopolitan magazine. and received the Ruth Bader Ginsburg Award from the Connecticut Democrats during their 2021 Women's Leadership Awards. Prior to receiving her master's in social work from the University of Connecticut in 2017, Liz graduated from the University of Tampa with a BA in sociology and criminology. We're thrilled to have you here today. Thanks so much, Liz.
Thank you so much. Hi, everyone. We're thrilled to be here. As mentioned, my name is Liz Gustafson, and my pronouns are she, hers, and I am the Connecticut State Director of Reproductive Equity Now. As mentioned, I am a proud advocate, abortion storyteller, and prior to joining the Reproductive Equity Now team, it was my honor to be a member of the Pro-Choice Connecticut team since 2018 and serve as the state director for 3 years. Today, I'm also joined by my colleague, Justine Hand, Reproductive Equity Now's Director of Development. So Reproductive Equity Now works to make equitable access to the full spectrum of reproductive health care a reality for all people, regardless of race, identity, immigration status, or how much money is in their bank account. Advancing reproductive equity and eliminating barriers to safe, legal abortion care are central to our mission. For more than 50 years, our strategy has been to engage in local organizing and advocacy to create statewide change. Last year, we expanded from Massachusetts to New Hampshire and Connecticut, picking up the mantle of our sibling organization, Pro-Choice Connecticut, to create the first regional organization in the country doing state level work. We are so grateful for the support of the Aurora Foundation and each of you, and are inspired and thrilled that your giving circle has chosen reproductive equity as your focus this year, as 2024 is a critical and consequential year in our collective fight to protect and expand access to comprehensive sexual and reproductive health care. I know we have some slides. Do you want to go ahead? Perfect. Thank you. So it is no secret that on a national scale, as you can see on this map, that anti-abortion extremists have worked state by state to eliminate access to reproductive health care and create regional abortion access deserts, forcing people to leave their homes and travel farther than ever before for care if they can afford to travel at all. Now, 1 in 3 people of reproductive age lives in a state with an abortion ban or restrictions that disproportionately impact people of color, low-income people, the LGBTQ+ community, and young people. These bans directly impact access here in Connecticut, as we've seen a steady increase in the number of patients traveling to our region for care as more and more bans go into effect across the South and Midwest. Next slide, please. So how do we respond? Our theory of change is that we must work state by state to build regional blocks for abortion access, starting right here in New England. By creating a regional powerhouse for reproductive health care advocacy across the Northeast, we can build unstoppable political power and organizing power across the country. And Connecticut is key to this regional power. We believe our model can be replicated. Working together, we can build back access to care state by state, region by region. We also believe this model is key to forming strategic and coordinated networks between New England states. We've already had the opportunity to connect providers and advocates across state lines to coordinate our responses to the mifepristone case that is currently before the Supreme Court. We hold monthly trainings with volunteers from across the region to offer the skills and information to be abortion access advocates in their own communities. And we've shared legislative and policy strategies across state lines to advance reproductive equity as a regional bloc. But importantly, we recognize that even in protected states like Connecticut, there is so much more work to do to ensure true reproductive equity for every person. The legal right to obtain reproductive health care does not mean much if there are barriers that stand in the way of access to that care, such as travel barriers, insurance barriers, cost barriers, language barriers, information barriers, and more. And our job is to dismantle the systems that stand in the way of accessing reproductive health care. And I feel that it's important to note that today does mark the last day of the 2024 legislative session. And during this year's session, alongside our cross-movement partners and legislative champions, we have been focused on going beyond Roe v. Wade, which we know historically left already marginalized communities behind, and so we can ensure equitable access to care for every person. Next slide, please. This legislative session, we worked with a coalition of partners to expand access to Husky coverage for all people, regardless of immigration status and age, to ensure everyone has access to the healthcare coverage that they need. We supported efforts that would begin to address barriers to equitable access to and insurance coverage of fertility care, especially for LGBTQ+ and single people, because everyone should have the ability to start or grow their family when and how they choose with the access to support that they need. We are proud that legislation was reintroduced this session that would protect providers from facing discipline or even job loss for following their oaths and sharing medically accurate information with their patients about their health status or referrals to an alternate provider for care, even if their employing institution does not offer that care, because we have to trust and empower physicians to provide the best standard of medical care to their patients, regardless of their employers. And as members of the Paid Sick Days Coalition, we are thrilled to report that earlier this week, legislation that expands paid sick days to working people was voted out of the Senate and is on its way to Governor Lamont's desk for signature. But with that said, we also acknowledge and know that our work does not stop in the Dome. Our team is also working to implement the law passed last legislative session to ensure meaningful access to sexual and reproductive health care on college campuses. Next slide, please. And one more slide. Perfect, thank you. We are organizing Connecticut communities to not only turn out in support of abortion and pro-repro policies in Hartford, but also to their ballot boxes this election day in support of candidates who champion reproductive equity up and down the ballot. We're educating cities and towns from Mansfield to Westport on ways they can access legitimate sexual and reproductive health care near them, and how to identify and avoid anti-abortion centers in their communities. Anti-abortion centers are the foot soldiers of the anti-abortion movement in access states like ours, and they strategically pose as full-service clinics, when in reality, their goal is to delay and dissuade people from accessing abortion care. These anti-abortion facilities outnumber legitimate clinics 3-1 in our region and are a major threat to access. So we continue to work to expose their deceptive practices and direct people towards legitimate care. Additional funds could help us expand our education and training programs in Connecticut. Next slide, please. We also have a great resource, the New England Abortion Care Guide, that is a one-stop shop for people seeking abortion care in our region. It offers information on what questions to ask when making an abortion appointment, what to expect before, during, and after an abortion, how to access financial support for the procedure or related costs, and more. It allows people to search by address to find up-to-date, legitimate abortion providers near them. We've also just translated the Abortion Care Guide into Spanish in order to reach more communities across our region, but we know that we need to go further. And so additional funding could help us translate the resource into additional languages, get this resource into more communities, and meet people where they are with advertisements at the places that they frequent. Next slide, please. We understand the best way we can continue to honor the decades-long legacy of the recently sunset Pro-Choice Connecticut and all who have and continue to volunteer, fundraised and championed reproductive freedom over the past 5 decades is to meet this moment with a bold and expanded vision for what reproductive equity can look like. Our state and our region have an obligation and an opportunity to be a beacon for reproductive freedom, to expand access to the full spectrum of comprehensive reproductive health care for everyone in Connecticut, to provide care options for those who live outside our borders via telehealth, and to set the national standard for what true reproductive equity looks like. That is the mission ahead of us. We have a lot of work ahead to ensure the Nutmeg State remains a leader for reproductive equity, and we're so excited to build our state and regional power alongside each of you. So again, I just want to say thank you for having us here today. Thank you for being here. Thank you for being a part of this fight, and thank you so much for your support.
Thank you so, so much, Liz. If you have a question for Liz, please put it in the chat, and we'll have a question and answer time after both speakers have presented today. So I am thrilled to welcome Zeri Watkins. She has served as Chief Operating Officer and Compliance Officer of Planned Parenthood Southern New England since January 2021. In those roles, Zeri is responsible for the management and oversight of clinical services at 15 locations throughout Connecticut and Rhode Island, telehealth services, various clinical support functions, clinical research, security, and the compliance and risk and quality management programs. Zeri leads the expansion, there's my computer going, of access to abortion care in this post-Roe era of sexual and reproductive health care. She serves on the boards of the Barbara J. Hawkins Foundation, Planned Parenthood Direct, Inc., and the Black Girl Health Collective, and is a member of the Florida Bar, the American College of Healthcare Executives, and the National Association of Healthcare Service Executives. She earned her undergraduate degree in sociology from Tulane University in New Orleans, Doctor of Jurisprudence from St. Thomas University in Miami, and Master of Business Administration from the University of Miami. In 2014, she was named in Legacy Magazine as one of the most powerful Black business leaders in South Florida. And in 2020, Legacy Magazine recognized her as one of the top 40 under 40 leaders of today and tomorrow. Welcome, Zeri. We're so pleased to have you.
Thank you so much. Good afternoon. It's afternoon now. Good afternoon, everyone. My pronouns are she, her, so I wanted to make sure that I mentioned that as well. I want to start by thanking you all for allowing myself and my colleague, Gretchen Raffa, who is our Vice President of Public Policy, Advocacy, and Organizing, to spend some time with you all this afternoon and to share the work that we're doing at PPS&E. I've prepared some brief remarks to share with you today and to talk about the health equity challenges we're seeing and what we're doing to meet our patients and our communities where they are. And so if I sound a little robotic in my delivery, that's the reason why. Next slide, please.
I go into the other room.
So as Dr. Stedman mentioned, PPS&E operates 15 health centers and offers telehealth services across Connecticut and Rhode Island, serving approximately 60,000 patients annually. 4 of those health centers are in the greater Hartford region, with locations in Hartford's North End, as well as West Hartford, Manchester, and Enfield. We served over 15,000 patients at those 4 centers last year and provided care through almost 27,000 visits. Nearly half of our Connecticut patients have public insurance. And at our Hartford North Clinic, that percentage is even higher. About 55% of the patients that we see in our Hartford North Clinic have public insurance. Most of our patients are struggling to afford the daily necessities, and they bring their entire lives with them to our health centers. We hear firsthand about the challenges that they face to care for themselves and their families. Next slide, please. So with that said, we're focused on creating a future where reproductive freedom is a reality for all folks. Based on our patients' experiences, along with broader public health data, we've identified 3 pressing health equity priorities in our 2 states where we're focusing our efforts to improve the health and well-being of our patients and communities. Our first priority is to increase access to abortion care. Here in Connecticut, while abortion rights are protected, we have an opportunity and an obligation to expand access to abortion care. As abortion becomes increasingly restricted, as Liz mentioned earlier, and outright banned in many states across the country, many people are forced to have to travel out of state to get care if they have the resources to do that. And even in our favorable policy climate here in Connecticut, there are many patients who face barriers to accessing the abortion care that they may need. So to address these challenges, PPS&E has created an abortion navigation program, which is staffed by a dedicated navigator who connects patients with the resources they need to obtain abortion care. We're also expanding access by training our advanced practice clinicians to provide first trimester procedural abortions, helping to decrease appointment wait times and increasing the number of abortion providers available in our state. Most recently, we launched our telehealth medication abortion services in Connecticut, which addresses the access barrier in terms of folks having difficulty traveling to our health centers. And it gives our patients one more option to seek abortion care in a modality that works best for them. Next slide, please. Oh, there it is, sorry. Our second priority is to decrease the rates of sexually transmitted infections, or STIs. There are shocking increases in the rates of STIs across the country, and it's becoming a public health crisis. These increasing rates are disproportionately rising in our Black and Latinx communities, as well as in the LGBTQ+ community. The rates of new infections are highest amongst Black men and trans women, but Black women are also testing positive with HIV infection at alarmingly high rates. In response to what we're seeing in our communities, PPS&E is implementing several strategies to decrease the spread of STIs in our state. Our health centers have recently launched express visits, which are designed to make STI testing quicker and easier to access. We're also working with young people through our teen peer educator and college intern programs to create social media content that helps to dispel myths about STI screening and educates these young folks about the importance of getting tested. If you don't already, I encourage you to follow us on social media at PPS&E everywhere to see what we're sharing on all our social media platforms. Many of our patients who come to us for STI screening, they're unable to pay for the cost of their care. And in the past 12 months alone, we've absorbed a few $100,000 worth of costs of STI screening tests for those folks that need it the most, because it's our mission to provide that care no matter what. Next slide, please. Our third health equity initiative is that we are committed to expanding access to gender affirming care in our state. Similar to abortion, we're seeing growing threats to gender affirming hormone therapy services across the country. To counter these barriers that so many trans and non-binary people face to access the care that they need, PPS&E is training our clinicians to ensure that gender affirming hormone therapy and the different options for PrEP, a medication that prevents the transmission of HIV, is available and accessible everywhere there's a Planned Parenthood health center. We've also added a navigator here who specializes in providing education, resources, and safe medical referrals to our transgender and non-binary patients receiving hormone therapy. So much of our ability to provide these innovative healthcare services is protected and bolstered by the incredible work of our policy, advocacy, and organizing team. And to tell you more about that, it's my pleasure to turn it over to my colleague, Gretchen Raffa.
Thanks so much, Zeri. Good afternoon, everyone. My name is Gretchen Raffa, Vice President of Public Policy, Advocacy, and Organizing with Planned Parenthood of Southern New England. And I am so thrilled to be here with all of you today. My voice is a little scratchy. I apologize. In the final few days of the legislative session, been talking a lot, trying to fight for the rights of our patients and our communities. But for folks that don't know about our advocacy and policy work, I always start by sharing. First of all, I've been doing this work in Connecticut. I've been with Planned Parenthood for 23 years, but been doing advocacy and lobbying and policy work in Connecticut for 20 years. And I oversee our advocacy and organizing team and policy team across Connecticut and Rhode Island. So advocating on behalf of our patients at the state capitol in Connecticut and as well as in Rhode Island. And at Planned Parenthood, as a reproductive health and rights organization, we believe that all people should have access to quality, affordable healthcare as a basic human right, regardless of who you are, where you live, your income, if you have health insurance. And we believe inherently that this care must remain free from shame, stigma, and political interference. And as Zeri shared a lot about what we are focused on as a healthcare provider and our healthcare delivery services by improving and expanding the services we provide through our research and through improving access to that care. We also do legal advocacy work, promoting public policy on the state and federal level to protect and defend sexual and reproductive health and rights. And we are working towards a world free from systems of oppression, where access to quality, affordable healthcare does not depend on your race, your socioeconomic status, sexual orientation, gender identity, religion, ability, or immigration status. And as a reproductive health and rights organization, we are committed to bringing an intersectional approach to the work that we do, fighting for all people to have full bodily autonomy, determine their own future, and decide without coercion or judgment whether and when to have children. So that means looking at issues that intersect with reproductive health and rights and some of the barriers that impact our patients' ability to even get to our health centers and access the care they need. We do that, and we are so grateful to do that in coalition and with our community partners like Reproductive Equity Now, She Leads Justice, Connecticut Alliance to End Sexual Violence, Connecticut Coalition Against Domestic Violence, the Husky for Immigrants campaign, Doulas for Connecticut, and so many other advocates across Connecticut that are essential in our movement to ensure reproductive freedom for all people. As Liz already pointed out, we know that, we are in a dire public health crisis in the United States. We know anti-abortion groups and politicians were never going to be satisfied with overturning Roe. And when they stripped us of our constitutional right with the Dobbs decision in 2022, it didn't just limit access to abortion. It made pregnancy outcomes more dangerous across this country. And these decisions, these court decisions that we are seeing in lower circuit courts and at the US Supreme Court, not only deny our freedoms to decide whether and when to become parents, but also how we become parents, with more threats to IVF and fertility healthcare we're seeing across the country as well. These courts' decisions didn't happen in a vacuum either. For years, anti-abortion lawmakers have been working to strip us of our rights beyond abortion care, but also birth control, and again, other reproductive health care. And as Zeri and Liz pointed out, we know the right to abortion is protected in our state, but our essential freedoms and bodily autonomy should not and cannot depend on where we live. We know the devastating consequences of the Dobbs decision have fallen largely on people who already face the greatest barriers to healthcare due to our country's legacy of systemic racism and discrimination. It has worsened existing health disparities and inequities and set back the progress we've made in the fight for reproductive rights, health, and justice. And we currently are awaiting 2 Supreme Court decisions this June, which can further limit and restrict access to abortion care for people that need it. But in the midst of all of this, Connecticut has taken swift action in the last 2 years and continue to lead the reproductive freedom movement in this country by expanding and broadening access to abortion care and contraceptive care. And we've been doing this with a bipartisan support. We are so grateful for the Lamont administration and our legislative champions, including the Reproductive Rights Caucus, to do everything they have in their power to protect our health and rights and secure more freedoms for the people in Connecticut or anyone who has to travel to our state to receive this care. Again, Zeri and Liz pointed out, we passed the most significant legislation in abortion rights legislation in a generation in 2022 by improving and updating our state-specific abortion statute that really has expanded access to abortion care for people across our state. And again, anyone that needs to travel here. And in the 2023 session, we further protected healthcare provider protections and patient protections by strengthening protections for healthcare providers against adverse action, such as protecting against suspension of their license or other penalties based on the provision of abortion care or gender affirming care, ensuring that providers can't be subjected to higher insurance rates. And these are all things that are incredibly important. And while we are working on on making legislative gains, our state administration has also actively been working to ensure that people in Connecticut and again across this country understand their rights and understand, the legal landscape. So we've been working closely with Governor Lamont, the Attorney General's office, to ensure that people, again, across the country, if they needed information about Connecticut laws and what their legal protections in Connecticut are, we have those protections in place with a statewide website, a statewide state hotline, so folks can call and get information about where they can seek comprehensive reproductive health care if they need to come to Connecticut. And as well as the Attorney General's office putting out a Know Your Rights brochure. So for people across Connecticut, and again, anyone that has to travel here, they understand what their rights are and what they need to do to access those rights. I won't be too repetitive because again, I know Liz touched upon a lot of this. Liz and I work very closely on a lot of this advocacy work. And, on top of the things that Liz already mentioned, I also wanted to mention some of the work going on around improving maternal and infant health outcomes. A really important bill was passed in the last legislative session to expand access to doula care by establishing a separate licensure category or by making sure that doulas have a certification process so that they would be able to get access to be reimbursed equitably for the care they deliver. So this is a multi-year process that we are in the state of Connecticut, working with the Doulas for Connecticut Coalition. There also has been the establishment of a licensure category for birthing centers in our state. And there's also been an establishment of a universal newborn nurse home visiting services so that more new parents have support services so that they can access essential care for their newborns and themselves. And also a lot of effort has been done to increase funding for endometriosis research and education. But again, as Liz said, we have a lot more work to do to continue thinking about how we are addressing the barriers that Planned Parenthood patients and patients that get care at other healthcare providers need to overcome to actually get the healthcare they need. And I want to highlight a couple of efforts that we are in coalition and working on, specifically, again, focusing on investing in the infrastructure and long-term sustainability of reproductive healthcare providers in our states. It is essential, especially for our patients that rely on Planned Parenthood, that we are here for them in the long term. So we are fighting for an equitable reimbursement rate in our Medicaid Husky Health program for reproductive health care. We are also working in partnership for improving or expanding access to Husky for immigrants who are income eligible regardless of their immigration status. We are working hard to improve and expand access to fertility care coverage so that our state law is aligned with the medical standard of care, which includes LGBTQ plus people and single people. We need to make sure that in the final hours of the legislative session that they pass the telehealth bill that is sitting on the Senate calendar, so that we have another 3 years of telehealth policy in Connecticut that went into effect during the COVID-19 pandemic. And we're also working with partners to ensure that the Department of Corrections has comprehensive oversight for their healthcare, because we know that regardless of who you are and where you are, and if you are someone that is within the Department of Corrections, you deserve access to the reproductive health care and the gender affirming healthcare you need to ensure that you stay healthy and again can access the healthcare you need. So I'm going to encourage everyone again to follow us on social media. We have a lot of volunteer opportunities. We organize across Connecticut and Rhode Island to ensure that we are continuing to give people the information and the resources they need so that they can organize in their communities. We are focused on building power with and for people who are most impacted by reproductive oppression in our state. And so that means a lot of the work we are doing is focusing on our patient advocacy program to identify people that are willing to speak out and advocate for reproductive and sexual and reproductive health and rights that are directly impacted by these policies that we are working to enact and trying to defeat any anti-reproductive health policies. And so our organizing team works to train and develop leaders who are confident in their ability to create the change they need in their communities, not only through our patient advocacy program, but as Zeri said, but also in our youth organizing program. You can get involved with us at the Capitol next session when it starts back up in January, so you can advocate with us and our coalition partners. And I would advocate for you right now to make sure that you are talking to your elected officials, both on the local level, state level, and federal level, on why sexual and reproductive health care is an urgent issue for people in our state. It is so important for them to hear from you. About why this issue is personally important to you. Share your stories, shout your stories. Storytelling is such a powerful tool for change, and stories are the way we connect to one another. We're sharing our values, sharing what's important to us, and helping to ensure that we are ending the shame and stigma surrounding reproductive health care, specifically abortion care. And that's why it's so important for you to share your stories. If you're interested in getting more involved, I am leaving my contact info for you. Feel free to call, text, email, and I'd be happy to chat with you about more ways to get involved, because we honestly can't do this without you. It's reproductive health care without interference from politicians and judges is rooted in freedom. And we will promise you and that everyone, no matter who you are, no matter where you live, has the fundamental right to reproductive freedom. Planned Parenthood is going to continue to fight for you and with you alongside our legislative champions, our coalition partners and communities to create a future where all people can make their own personal decisions for themselves and their families free from government interference. Thank you so much for considering supporting our organization and the work we do in our communities across Connecticut.
Thank you so much, Gretchen and Zeri and Liz. So we're gonna open it up. If folks have questions for either organization, we'd love to hear from you. I don't think we've seen any questions in the chat, but.
I have a question. This is Chloe. Hi, can you hear me? Yep. Cool. Okay, first of all, thank you so much, Liz, Zeri, and Gretchen. I can't thank you enough for everything you're doing and your intrepidity. I may have missed it on the Planned Parenthood presentation. What would the money be used for from the Giving Circle? That's one question. Then the other question is, how do the two organizations ensure that you're not, because I think it's fantastic that you're collaborating as much as possible, and how do you ensure that you are not duplicating or squandering your efforts by duplicating them? So the first question is Planned Parenthood and the second one is to anyone who'll answer. Thank you.
Sure. I'll take the first stab at it because I think I can potentially accomplish answering both questions for PPS&E. I mentioned to you all during my remarks that we are subsidizing a certain amount of care that we provide. Most specifically, we are subsidizing the testing and treatment for STIs to make sure that folks in our community are getting tested and getting treated timely. And this is something that, as I mentioned before, is becoming a public health crisis, not just in Connecticut, but across the country. And we have been working and we continue to work in partnership with the state of Connecticut to make sure that we can adequately fund what's the resources required to provide STI testing to all the communities that we serve, particularly for the most marginally impacted groups in our communities who might not be able to afford that type of testing. It's not, if you don't have insurance, getting tested for STIs is not cheap by any means. Also, you know, what we've started with our navigators, both our abortion navigator and our gender affirming care navigator, I am very proud of that. You know, we were able to answer the call pretty quickly when the Dobbs decision came down in June of 2022. And, you know, we didn't identify any funding. We just said, we need to do this, and we did it. And we've essentially baked it into our budget, but those are the areas, particularly as it pertains to what our health equity goals are, that this funding would go towards.
Thank you.
Liz, could you, I know it was in your presentation where the funding would go, but could you just reiterate for everyone?
Absolutely. I see the New England Abortion Care Guide. It is a patient-centered guide and a one-stop shop for people seeking abortion care in our region, and additional funding. As mentioned, it is now translated into Spanish, but additional funding would assist us in getting that translated into more languages, and also getting the resource into communities and advertising so that we're meeting people where they are at. And also our volunteer programs, such as our AAA program that was mentioned, is a great resource, a regional resource, so people can get trained and informed on how they can be advocates in their own community. I know between Ren and PPS&E, we both see the value in folks really knowing how to be advocates in their own community on behalf of their own community. And I think this moment really demands each and every one of us to know what resources are available, how to talk about abortion, how to support people who are seeking abortion, and how to be that for someone you may know and love. And so funding would absolutely help us with our education and training programs.
And can you say a little bit about, to answer Chloe's question about collaboration and, you know, how you all work together as opposed to duplicating your efforts?
So I know I work very closely with Gretchen under the dome on the lobbying advocacy side of things. I also see Reproductive Equity Now's role as also an advocate on behalf of providers as well. I'll add that I myself am a patient of Planned Parenthood, from my routine OBGYN care to my abortion care. So we are really able to collaborate and expand our capacity in that way. We are stronger when we are together and fighting together. And I don't know if y'all want to add anything.
Yeah, I would just echo what Liz said. I want to say that none of the advocacy and policy work happens in you know, a silo. And before I came here, 20 plus years ago, there was another iteration of coalition partners doing this work. And Planned Parenthood feels strongly that, you know, again, just to echo what Liz said, we are stronger when all of our community partners are well-resourced, working together in collaboration for a shared vision for reproductive freedom. And some of the work that, you know, we are doing hand in hand with our cross movement partners, you know, we add a reproductive health and rights lens to why paid sick days or paid family medical leave is an issue for Planned Parenthood patients who walk through our doors every day. You know, so we are looking at, again, not just reproductive health and rights organizations to partner with, but a broader coalition on issues that impact people's ability to access the essential healthcare they need. And just to kind of distinguish kind of our roles too. When I'm at the Capitol lobbying on behalf of Planned Parenthood, I am lobbying as Planned Parenthood of Southern New England. And like Liz said, she's the advocate for the providers. I am bringing the providers' voice to the legislature, sometimes relying on our providers, like our chief medical officer oftentimes will, you know, testify if it's really important to have, you know, the actual medical provider you know, lobbying. But I'm up at the Capitol every day and about to head there right now on behalf of, you know, us as a healthcare provider too. So I just wanted to make sure that folks understood our role at the Capitol too.
That's
I
really
hope that answered
helpful.
your question.
Thank you.
Do we have any other questions? And that was Ann Thomas's question about clarifying the use of the Giving Circle fund. So thank you, Ann.
I'll ask another question.
Go,
This is
Chloe.
Yeah, it's not my show, really. So I see the wisdom of regional efforts, and I think I got the map right. It was pretty quick about the level of protections by state, and it looks like, and I'm not surprised that there are a couple of states in our region at least that are not anywhere near where Connecticut is. I know Connecticut is in the forefront, but I'm just wondering how you two organizations are, how you handle distributing your resources to bring the whole region along versus bringing Connecticut forward. I don't know if that makes any sense.
I can take an initial go at that. Before Reproductive Equity Now expanded into Connecticut, I think a really great example of this kind of cross-border, cross-state collaboration is when we passed our SHIELD law. But it was actually the week of the Dobbs opinion leak that happened. And we held a press conference and we talked about our efforts to pass the first SHIELD law in the country. And I got a text message from our president, Rebecca Hart-Holder, saying, can we touch base at some point today? Can you connect me with legislators? Because we want to do the same thing en masse. And so already over the past few decades, especially the past few years, we've been sharing strategies across our state borders because we also recognize that our borders are porous and people are already traveling for work, for play, etc. And they're also doing the same to access comprehensive sexual and reproductive health care. And so we see this approach as an effective way to share those strategies across state lines and to bring along each state in the New England region.
Great.
And I would just chime in too, as Planned Parenthood of Southern New England, we've been doing work in Connecticut and Rhode Island for almost 20 years as an affiliate. And, you know, a lot of the advocacy and policy work that we have we had achieved in Connecticut is lessons learned for how we got to the place we are in Rhode Island, securing the right to legal abortion in 2019, securing Medicaid coverage for abortion care last year, hopefully passing provider protection shield law this year in Rhode Island, but also talking to colleagues in our Northern New England affiliate, which is Vermont, New Hampshire, and Maine, and learning from them, as well as our affiliate colleagues in Massachusetts and New York, to kind of learn more about what our border states are doing. But I think, again, just to echo what Liz says, sharing strategy of what worked, and even from like communications and messaging strategy regarding policy. And I'll let Zeri chime in to address this on the healthcare side too.
Yeah, on the ground, what that looks like is, you know, for the folks who don't know, our Planned Parenthood affiliate is one of 49 Planned Parenthood affiliates across the country. And so in the delivery of care and then the delivery of services, we often look to our colleagues in other states to, you know, innovate, to, if there is a modality of service that we're not providing and someone else is doing it, we try to emulate that to the extent that we can, so that we can be as expansive as possible and provide our patients with as many options as possible in how they receive care. And I think the most tangible way that we've been able to demonstrate that post Dobbs is that there are actually literally patients that come from Texas, that come from Arizona, that come from banned states, and they receive care in our health centers. And we also get folks from New York too, just for the convenience of it.
Thank you.
Thanks so much. We're closing in on time, but I did want to answer a question I got by email from Mickey Maddie, who was asking about whether Aurora and the Giving Circle can fund lobbying. So you'll notice that the funding options and priorities that both groups gave us are not related to their lobbying efforts, although that is an important part of what they do. That we'll be helping with their education and organizing, or their actual healthcare delivery for the funding from the Women's Giving Circle. So I hope that helps to clarify. And thanks for asking that, Mickey. It's a great question. And I'm going to turn it over to Marie with just a couple of housekeeping reminders. And I thank you to our presenters. Thank you to our fabulous group. We will also be sending out the recording later this week so that you can share it with everyone.
Yes, absolutely. Be on the lookout for that. Please share it. And thank you so much to the speakers. This was invaluable information, and it's just so important. So you saw in my chat, if you plan on joining us for the final lunch, if you could just email me, marie@aurorafoundation.org. And then we hope you're able to join us next Wednesday, when we will hear from our other two partners.